Hey, Brian.
Hey, Dr. Blue.
Hi. You've just finished with a patient?
Yeah, I was just about to have a chat with you about that in your office.
We can chat now, or would you rather chat in the swing office? Or...
No, out here is fine if you're okay with it.
Okay,
if
cool.
You're fine
So
with
who'd
it.
you see?
I saw Mrs.
Chan?
Mrs. Chan, yes. Yeah, Mrs. Chan, 55, a Chinese woman. She had some language issues. English isn't her first, but I think I did okay.
And what brings her here, Brian?
I'm just getting to that. She came into the emergency with abdominal pelvic pain. It basically started this morning, and she describes it as a horrible belly pain, kind of to her to her back. She woke up. The pain is bad. Now she said it was a 10 out of 10, but her language wasn't so great. So I basically thought it was more of a 7 or 8 based on her reactions. She had nausea, a little bit of vomiting, of emesis. And now it's sort of a cramping pain. And she tried Tylenol, but it didn't seem to do anything. And yeah.
Okay, finish the history.
Right. She had a husband who died 2 years ago, a daughter who couldn't leave work.
Past medical history.
Okay, I did take that.
Yeah.
COPD, diabetes, and she's had pancreatitis.
Any medications?
Yeah, metformin, for sure. Not sure of the dose. Metoprolol, omeprazole.
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 Go on.
Aspirin every day, and lisinopril.
Okay, so she has hypertension, too. Does she smoke?
Yeah, definitely. About a pack a day for 20 years. She also takes Percocet. Not sure the dose, and she says she doesn't take any other drugs or drink, but I think she did mention sherry, I think.
Systems.
Systems, in general, she's basically pretty healthy. Her weight changes sometimes. It goes up and down, basically 5 to 7 pounds. No trouble breathing, really. No chest pain, the belly stuff that we just talked about. Her last period was basically 5 years ago. Now, she doesn't seem to remember or recall when her last pap smear was, but it has probably been a really long time. Vitals are stable. She does not look in distress, apart from the pain, of course. Her chest was clear, heart sounds normal.
Did you examine her abdomen?
She wasn't super comfortable with me, but I managed to get it all in the examination. Her abdomen was bloated, but I couldn't find any masses. She complained about tenderness with palpation all around her abdomen, but it was her upper abdomen that was the most tender. Couldn't find any rebound tenderness. Vitals are stable, and she doesn't look to be in any distress except for the pains, of course. The groins were free of disease, but I did not do a pelvic exam. Like I said, she wasn't super comfortable with me. And the rest of the exam was basically totally normal.
What's her pain like now?
Well, she just kept talking about how bad the pain was, but now she just describes it as a cramp.
Okay, tell me more about her history of pancreatitis. Or why is she on the omeprazole?
Jeez, she was really vague on the details.
Does she have any urinary symptoms?
I don't.
Oh,
no,
okay,
I don't think
okay,
so.
Brian. What do you think is going on? What's your differential diagnosis?
Well, she could be having another bout of pancreatitis, or ulcer, or kidney stone.
Does she have symptoms of pancreatitis?
She has pain, but I don't think she has nausea or vomiting.
Do you know what the other symptoms of pancreatitis are?
Yes, fever, pain, nausea, tachycardia.
Yeah, well, the classic symptom of pancreatitis is a dull, boring, and steady abdominal pain. The onset of the pain is usually sudden, and the pain gradually intensifies until it reaches a steady ache. The pain is usually located in the epigastric area and radiated directly through the abdomen to the back. It is often alleviated by the patient sitting forward. The patient may complain of nausea and vomiting.
Oh yeah, she did vomit.
The classic causes of acute pancreatitis are gallstones and toxin exposure like alcohol or medications. Or it may be brought on by a recent operative procedure. Or there may be a family history of hypertriglycemia. Brian, on clinical exam, you've got to check for fever, tachycardia, abdominal tenderness, guarding, and distension. What's your color? The patient could be jaundiced if gallstones are the cause. You've got to look for signs, Brian. You've got to look for any complications. We really don't know what's going on unless we have answers, right? Answers. Okay. Why don't we go examine the patient together? You stand and watch, because the fact is, I am not clear as to what's going on with this patient. We can't have that vagueness around here. You have to be crisper, Brian, when presenting your patient history. You have to be crisper.
Right.
Okay, let's go. You can't tell me what her vital signs were by any chance, can you?